Hello, sweet friends. Welcome back to another sweet episode of Still Positive. We are double sweet here today, and that is why I said sweet twice, because you're a sweet friend. Thank you for tuning into this episode. Today we're talking to Mandy. Mandy lives with metastatic breast cancer, but is also with no evidence of disease. So definitely different from anyone that I've talked to on this podcast. And it was really cool to hear about her experience and how she lives her life. Just a disclaimer, we do talk about a lot of food and health related things, including supplements. That is not always for everyone. So just a heads up for that one. You are your own person. You are your own body. You know it best. But also make sure that you consult with your doctor before you take anything from this episode to heart, and make sure that it's right for you with your doctor and your body and your treatments and things that are going through. So just a quick disclaimer on that. But I loved talking to Mandy. I think that her attitude is amazing. I loved hearing about her journey with metastatic breast cancer, but also her journey with marijuana and medical marijuana and how that has helped her through her process. I think that for cancer patients, definitely something to look into. Talk with your doctor about it and make sure that's right for you again, but also helpful for those who might be experiencing stress or anxiety or trouble sleeping, side effects from chemo, things like this. All the above. Weed is great. I love weed. Definitely. Okay. Anyway, so this is our episode with Mandy. Please listen in, and I hope you enjoy. I'm Dayna Murray, and this is Still Positive. Let's be real. People love to gloss over chronic conditions or disabilities with a fleeting comment like, just be positive, or a fleeting insult like, kale will cure you, as if your life was that easy of a fix. This is a podcast for when you face a different reality, knowing that positivity isn't a magic wand that's going to cure everything, but a flashlight in the dark that we may or may not have batteries to. Living with a chronic illness or disability makes you feel different, and your difference could be noticeable to others or not, but either can sometimes make you feel invisible. I'm here to tell you that your experience is valid and shared by others in the dark. Positivity is not the missing puzzle piece that's going to solve your life's puzzle, but it can be a beautiful tool that can help you grow, and sharing those experiences can make us grow together. So, Mandy, thank you so much for joining on Still Positive. I was really inspired by looking at your posts because of your journey with metastatic breast cancer. And I was wondering if you could tell us a little bit about your cancer history.
Sure. So thanks again so much for having me.
Mm-hmm.
And I was diagnosed in the fall of 2018. And when I was diagnosed, there was just a full stop to my life. I am a somatic body worker and holistic educator and have maintained a private practice here in Southern California for more than 20 years. And so when I was diagnosed, it was very clear that the type of work that I do is both physically demanding and emotional labor, essentially, that I am holding space for, and for so many of my clients, that was just not going to be sustainable in order for me to navigate this existential healing crisis of a cancer diagnosis. And the moment that it happened, I just remember this like deafening silence and just complete and utter shock. But thankfully, my somatic training and my many, many years of kind of embodied practice helped me to kind of come back into my body, scan my surroundings, remind my nervous system that while it feels as if I am in complete imminent danger, I'm still breathing, and my children still need to have dinner. And so it really was this kind of, okay, collect yourself from these shattered pieces of broken disbelief and pull it together so we can like run full speed ahead in the direction of a full restoration of my vitality and complete healing. And so that was really the intent that I set from day one. And with many moving parts and an extraordinary amount of resources and support, I was able to achieve that. In 6 months of my diagnosis, I was declared no evidence of disease.
Wow.
So that's stunning.
That
And
is.
it's still just totally bizarre to hear myself say. But yeah, it was miraculous and incredible. And I'm grateful for it every day. And I'm still totally coming to terms with, I'm not done. I'm never done. This is my life now. I continue to receive life extending conventional treatment, pharmaceutical medicine, on a monthly basis, and have to deal with the fallout of navigating conventional treatment and preventing disease reoccurrence and being in medically induced menopause because my breast cancer was triple positive. So receptive to estrogen, progesterone, and also HER2 positive.
So you were diagnosed, and when you were first diagnosed, was it already metastatic at that point?
When I was first diagnosed, the way I was diagnosed is, and like 40% of all breast cancer diagnoses come from women detecting their own tissue changes. So as a somatic body worker, I'm a massage therapist. A lot of my work is actually teaching guided self lymphatic massage. And I have a regular practice of self massage. And in the summer of 2018, it came to my attention when I was gifted by a wonderful herbalist this just delicious specific breast massage oil, that my breasts were really being neglected from my self-massage practice, that I really focused my self-massage practice on regions where I was experiencing pain and discomfort. And that I was skipping altogether, this vitally important region of my body. And that the last time I had been really accustomed to touching and understanding the terrain of my breasts was when my little ones were breastfeeding. So that had been several years prior. So when I was gifted this breast oil, I immediately started a daily breast massage practice. And within the course of just a couple of weeks, I was able to recognize, like, okay, I cannot ignore that this feels different than 3-4 years ago, the last time I was a nursing mother. And I need to do something about it.
Wow. So then did you go straight for a scan at that point?
At that point, I went to my primary care physician and I already had on the books, like it was time for my kind of annual that I had not been getting for a couple of years, because I was really in this cycle as a mother to young children of just like irresponsible martyrdom and not taking the time to do my own health maintenance. And I had been really waiting for this moment of the fall of 2018 was going to be the first time in a decade since I had been gestating or breastfeeding or parenting my 2 children, that both of them were going to be in full-time school. And so I was really gearing up and preparing for, like, this was going to be a massive transition in my life where I was really going to begin to fold back in myself. So I'd already scheduled like all of the kind of like the oil change, the dental work, the primary care physician. And when I was there to do like the full blood panel and the pap smear and all of the things, I said to her, I've been tracking some tissue changes. When I was a breastfeeding mother, I was prone to mastitis, which is infection of the milk ducts. I had a real problematic time with that. And I think this is scar tissue related to that. but like, can we just look at it?
Mm-hmm.
She said to me, you know what, you're 3 years before the standard kind of diagnostic mammogram age. And I was like, I don't care.
Right.
If you feel something, let's do something. And would you at least give me a breast exam? And once she did, she said, yes, you are going to see a breast specialist.
Wow.
And they're walking me into the radiologist's office for a sonogram and immediate biopsy. Like, it was clearly evident we're dealing with something here. You know, I was seeing the images, and everywhere there's signs saying like, do not take pictures of these images. They do not belong to you. You cannot have your phone in here. And I was like, absolutely not. This is my body. These are my images. Click, click, click.
Mm-hmm.
And so it was very clear, you know, there was a web of calcified tissue in my right breast.
Wow.
So when I was diagnosed, at that point, we only knew that it was local. And then when I received the scans, that took, I want to say, 3 weeks.
Mm-hmm.
And then we understood that it was metastatic. It had metastasized all throughout my lymphatic system and to the bones of my vertebrae, my thoracic spine. So once that happened, the shit hit the fan. My current healthcare providers at that time, it just became a mess. And unfortunately, you know, the providers that I was with were really not set up for breast oncology specialty. This oncologist that I was first referred to worked with every kind of cancer under the sun. And it was dark when we met.
Like the conversation was dark, or
it was, she was setting me up for palliative care
without even like a second opinion, just immediately setting you up for that. Okay.
Like, and so I went and sought a second opinion.
Yeah. Yeah. Okay.
And I was really fortunate that all of this was going down at the very moment in time in the year where open enrollment for our conventional healthcare insurance was happening. So I was able to, in like this 1 week time of, I had just met with my referred oncologist. It's the last week of open enrollment. I was able to, by like the grace of spirit and basically putting a call out, like deciding that I was going to be doing this transparently and letting my community know what was happening to me in real time. Once we had shared it with my children. And so that was kind of a multiple week window of like holding that close. And then once we shared it with our children, I shared it with the greater community. And doing that helped me gain access to the head of breast oncology at our local research hospital here in San Diego County, who is at the forefront of all international breast cancer research and clinical trials. And so he was willing to meet with me day of. And the first thing he said to me and my spouse and my mother on meeting was that we have every reason to believe that you are going to outlive my practice.
Oh.
Those were the first words out of his mouth.
Oh my gosh.
It was truly like a you had me at hello moment.
Right. Yeah.
And then beyond that, I also see the head of their integrative medicine department. He's essentially an integrative oncologist and functional medicine doctor. And what is like very synergistic and magical about our pairing is that in 1981, the year I was born, he was writing his PhD dissertation on how triple positive breast cancer was going to be the next like most lethal thing, and that the scientific community needed to be pouring their research into this aspect of breast cancer. And that's absolutely correct. When I was my daughter's age, this was hands down a lethal diagnosis. And so the friends of mine whose mothers were diagnosed when we were children did not have access to the medicine that I have today. And it is their disease process that has led to me having a full response to medicine and full recovery, and have, when and if a disease progression happens, there are multiple options of different kind of cocktails for triple positive breast cancer for me, because of the research that was poured into, much in part from the research that my now integrative oncologist was a part of.
That's amazing.
So, like, I absolutely identify as a practitioner of healing, a practitioner of magic, a witch. And so when this kind of synchronistic stuff happens, and absolutely like in an academic, data-driven, evidence-based environments, because those two things are not mutually exclusive, it just feels like, really pay attention here. Like, okay, we're doing it right. This is the right team. I am like building my healing council, and he has continued to be one of my biggest cheerleaders in everything from using cannabis as medicine to geeking out with me for hours, dialoguing about medicinal mushrooms. And he's a huge part of the research with like foremost mycologists on specifically medicinal mushrooms, both for cancer as well as for COVID, for comprehensive, deep immune building. So yeah, it's exciting, and I feel very fortunate to have access to some of, modern medicine's most brilliant minds and practitioners.
Yes, absolutely. And that's amazing that they are so open to such innovative fields like you're talking about, because that's not the case for many a doctor. So I think that you've definitely found the right match. And I think that it's really cool to see research and development in this way where, they are taking in other types of Eastern medicines that we don't really think about here at all. In a lot of doctors' offices, they just think of it as a lawsuit, so they don't even touch upon it. Even asking a question, they won't answer the question. They're just
Absolutely.
Hands off completely.
And the reality is my traditional oncologist, even though they're part of the same teaching hospital, the same network, there is a very real banter between these two practitioners. My traditional oncologist would absolutely say, it doesn't matter what you eat. The nutrition is not what's killing the cancer. The chemo is killing the cancer. It's like, he'll kind of dig at the integrative oncologist, but in very respectful ways, and is respectful to me. I actually kind of enjoy that there is this like devil's advocate kind of thing that happens, and that I get to have like the best of both worlds, because the integrative oncologist, he does the same thing, and that he understands that my conventional oncologist is not going to have any of this stuff on their radar. Even though, they run in the same medical community. And so, it does require an immense amount of self-actualization, self-advocacy, research, and kind of enough chutzpah to demand the type of treatment and care that I need, and that I expect, and that I deserve.
Right.
And part of how I'm able to do that is, again, because I'm not doing it alone. I have, an extraordinary network of support and access to very real resources that, when I was in the depth of a disease and my kind of cancer descent, those people and that support network really were making the rest of my life work, so that I could just pour myself into hours and hours of information gathering and research, so that I could understand what was going to be right for me while I still had my cognitive abilities. Because, we know months into conventional treatment, no matter how many holistic modalities you're utilizing to support yourself, one thing that kind of goes out the door is, high cognitive function and an ability to self-advocate.
Right. 1,000%. And so what sort of resources were you diving into when you first got diagnosed? Because like you said, it's definitely something with cognitive function later down the line. But when you first get diagnosed as well, it's also stress, trauma, all of these things that are sort of blocking your ability to sort of see clearly sometimes. And even when you're reading things, spiraling off into, oh, this says this, and like maybe this is me, and whatever. So, what did you take, and what sort of resources did you first go to when you were first looking into this?
That's a really good point and a great question. Thank you. I know that at that time, the many years of kind of cultivating natural immersion practices were absolutely a backbone of how I navigated, but also cannabis. Cannabis helped me stay embodied, helped me stay connected to that aspect of my identity that is essential to who I am, that will never shift no matter what circumstances change in my life. And so that kind of helped me filter out all of the trauma speech. And I had to be really cautious about not going too far down any internet rabbit holes, about cancer. When I looked into the various theories and ideas and approaches to nutrition for a healing crisis, I found that there was kind of this Venn diagram, of theories. And I basically felt like everything that fell in the center of the Venn diagram was something that I wanted to, follow through with myself. And if it resonated for me. And
Right.
what resonated for me was to full stop, no alcohol, full stop, no animal products. I went full plant-based. And I really wanted to maximize my caloric intake with just high vitality foods. So I was basically juicing pounds of fruits and vegetables. And there were a few people out there that were really in support of this. But one of the major resources is this book that I was referred to through both the integrative oncologist and through a client of mine who has been living with pancreatic cancer. And so they had referred this book to me by Paul Pitchford. I believe it's something to the degree of healing foods through Asian modalities, something like this. And it basically is, the encyclopedia of ancestral foods for traditional Chinese medicine, and all of the actual data and scientific research to support what these foods do for our bodies. And then also Chris Stark, I want to say is his name. Chris Beat Cancer is his book. He had I really enjoyed that resource because it was easy, concise, to the point. It was easy to if there were parts of it that didn't resonate, to just take what works for you and set the rest aside. So I continue to refer people when they're navigating healing crisis, or they have a loved one that's been diagnosed and they're like, tell me everything you did. Those two books are high on the list. And then also Paul Stamets. Paul Stamets is just an American treasure. We are so fortunate to have this extraordinary being, this scientist, the foremost mycologist probably in the world. And his TED Talk I watched in the first few days following my diagnosis, and he spoke to his 88-year-old mother diagnosed with triple positive breast cancer, and she proceeding with the same standard protocol that I would be navigating pharmaceutically that he likewise immediately got his mother on turkey tail mushrooms and on this comprehensive blend of lion's mane and chaga and reishi, all these incredible medicinal mushrooms that he had been studying at that point for like 30 years. And she had a full response to treatment and a complete recovery. So that really awoke me to, I had already very much had kind of the mycelium like in my body, so to speak, recreationally and, spiritually through medicine journeys with psilocybin. But day one, after hearing his TED talk and beginning to kind of follow that thread through to his actual, research that can, be found through the National Institute of Health. And I put the call out to my community again, and like the plant wizards showed up. So I had, piles of cannabis that I was just dousing my body in topically or juicing. And then, mycologists locally were foraging turkey tail for me that I still to this day, will brew in my bone broths that I make weekly. And so those were some big resources that felt really grounded in the kind of Eastern medicine that you've spoken to, and an integrative approach, which comes naturally and easy to me because I've been in that world for 20 plus years already. So I already have that kind of foundational language and understanding.
At this time, were you telling your conventional oncologist about all the supplements that you were taking too?
I was, yeah. And he had his reservations, but he was like, I mean, I get it. You are looking at death's door right now. This is big time. And so you're going to throw everything at it. I can't guarantee that it's not going to interfere with your treatment, but you do you, and because he could sense that I was going to anyways, and like I said, because even though the integrative oncologist, the integrative practitioner, I don't even know that he would refer to himself as an integrative oncologist. He would refer to himself as an integrative physician. But he has become that in my life because he is grounded in the cancer world also. All of his initial, studies were in cancer care. And in the development of chemotherapies and monoclonal antibodies, like the very drugs that I'm in, that was like his foundational work. And then when maybe like 10 years later, once he was an MD practicing, his father was diagnosed and he became his caretaker. And when it was his own family, felt really compelled to kind of go to the further reaches of any potential access to medicine or modalities that could help save his father. And that ultimately totally reoriented him to traditional Chinese medicine, to herbs, to the fungi, and to this approach that, once again, I now get to help reap the benefits of. And it's so cool. Like him and Paul Stamets, they are colleagues. I come to find out it just was another one of those like breadcrumbs of synchronicity that was like, oh, I'm doing it right. This is working. Okay. The Healing Council is supporting me, is coming together because, I come to find out that the mushrooms that Dr. Gordon Sachs is the integrative practitioner that I've been referring to and the head of integrative medicine at UCSD. The mushrooms that he's accessing and utilizing for all of this research come from Paul Stamets, this foremost mycologist. So it just, again, was like, and we all can have access to this medicine because his brand of medicinal mushroom supplements is called Host Defense. He farms them all organically in the state of Oregon. And you can get it at any health food store. And I'm no affiliate or influencer. I don't get anything for like loving them and shouting their name from the rooftops. I just really, truly believe in their product and benefit from it, as I believe my entire family too. Like we've never been healthier, and I'm living with metastatic breast cancer.
Yeah, so they just said you were free from disease, but that you're
No
not,
evidence of
no
disease.
evidence.
No
Okay.
evidence of disease. So for me, that's enough to like, yes, I am free from disease.
Right.
But and as is my integrative practitioner, as is the whole of my community. But in conventional chemotherapy oncology world, no, I'm stage 4, it metastasized. And so they presume, the assumption is that cancer still exists in my body. And it's just at such a minuscule amount that it cannot be visually detected.
Mm-hmm.
And so I continue to have infusions, IV meds every 3 weeks. I was in medically induced menopause through injections of a 16 gauge needle directly into my abdomen to suppress all hormonal activity until 1 year ago, I decided that I was ready to just remove my ovaries so that it felt like that was the less invasive way, honestly, than having to have a monthly injection and my body like suppress.
Mm-hmm.
Um, so
So I have so many questions with that too. Like for the medically induced menopause, did you actually end up getting your period back at any point, or was it
I never stopped bleeding in
really?
conventional. Like, holy smokes, the estrogen is real in my body. And they told me as soon as conventional treatment began, my period would go away, and that they would then keep me in medically induced menopause once treatment was complete. But it didn't go away
Hmm.
until treatment was complete and they started doing Zoladex injections.
Hmm.
And so while I was receiving chemotherapy, I was still having my, just like textbook, very healthy every 28 days cycle, and really grieving the natural timeline of my body and recognizing that this was something that was going to be going away, and that, the aspect of my body that led to me both biologically, and personally, socially identifying as a woman, and the part of me that made me a biological mother, was also contributing to nearly killing me.
Yeah.
And I love life enough to like let that part of me go. And absolutely, once the laparoscopic, very simple kind of procedure happened, but it was the first time I'd ever been put under and intubated, and that was pretty nerve-wracking given everything with COVID. Um, I absolutely kind of crashed into a bit of a depression and just grief stricken, and kind of a re-exposure to the initial trauma,
Mm-hmm. Mm-hmm.
of just receiving so much treatment and really having to reorient to this new identity. And
Absolutely.
that lasted, I'd say, for like 3 or 4 months. And then, thankfully, cyclically, as so many things do, that it shifted. And now, I feel, it's interesting. I still feel like a cyclical human. Like I still cycle, even though I'm not menstruating, and I am taking, daily pharmaceuticals, because now I'm on tamoxifen, which is a daily oral. Um,
Is that
and
for estrogen or?
from what I understand, it helps to kind of create a barrier over cell receptors that are hormone receptive.
Okay.
And I'm very fortunate in that a lot of women have a really hard time with that med. That tamoxifen is kind of one of the old guard pharmaceuticals, conventional treatment of breast cancer. It's been around a long time. A lot of women have been on it for a long time. Younger women like myself are generally only on it for very small windows of time when they're being like temporarily placed in medically induced menopause, with the idea that few years, maybe if they weren't stage 4 with their diagnosis, a few years down the line, they'll stop tamoxifen and be able to procreate if they so choose, possibly. That's not the case for me with a stage 4 diagnosis, but I'm fortunate in that my body seems to be dealing with the fallout of these major pharmaceuticals really quite well. And again, I believe that to be in part of, the other choices that I'm making to support my health, like cannabis and nutrition and the fungi and deep rest and, just a network of support. Because my body, generally speaking, feels relatively well, despite, having all of these substances in me and being in very early onset menopause and navigating very real trauma and the brain kind of barriers that I come up against with that. Despite all of that, I've adapted. And so there's some times where I have to remind myself, and my conventional oncologist has to remind me, you're a person living with metastatic breast cancer. There might not be disease that we're actively fighting right now, but you need to live as if you are, and you need to identify as if you are, and slow down, or whatever it is,
Did he say that?
Yeah.
No.
Yeah. Yeah. And he and I have had a lot of conversations about, like, there was one time not too long ago where I was navigating some like mystery symptoms that were very uncomfortable.
Totally.
And he was immediately convinced that this was disease progression. And he said to me that it is, in all likelihood, you are having a disease progression. So we need to get a scan, and we'll change your medicine, and the pain will go away because the cancer will go away. That was so challenging to go through. The 4 or 5 days that it took to get that scan and get the results and find out, no, there's no disease progression. I'm just dealing with the fallout of these meds and being in a new body that I'm coming to understand,
Totally. Yeah.
and, aging.
Yeah.
I had to tell him that was immensely insensitive and completely added to my pain and trauma. And the pain actually spiked to nearly inconceivable levels that almost like I was really having to come down to the moment of like, do I go to the emergency room and get IV meds to stop this pain? And having my treating physician so secure in his presumption that this was a disease progression was absolutely life-shattering and heartbreaking to me. I felt in those few days like a complete loss of hope in everything that I have placed all of my stock in, all of my chips in. I really thought I was going to have more time.
Well, that's where it gets so challenging, especially when you have taken such hold of your own healing path and like blaming yourself or something that you've done when really cancer forms differently and mutates. Like that's the thing about it, And so like blaming or like the investment in everything that you've done for yourself, it can feel so heartbreaking and detrimental regardless of even if you tried to do something, but then when you have tried so much and to have it completely shattered because cancer is just cancer. And I feel like a lot of people have dealt with that, like going through it, thinking you're fine, thinking you're not. And it's such a roller coaster. And that is one of the most heartbreaking things. So I'm glad that it wasn't cancer progression for that specific moment.
Thank you.
Yeah.
It was awful because there is that. We all have to, in this kind of chronic illness world, and especially like with all of the powerful, painful associations that go along with every sensation that happens can send you into a spiral of like, I mean, I can't count how many times a day there is a track in my mind saying, is the cancer back? Is that the cancer?
Mm-hmm.
And so when you're in a pain spike or a flare of any symptoms, that kind of sound bite is constantly running. And so for my treating physician to be so clear and so sure, there was a lot of blame and shame that I was internalizing, because I thought, think of all of those maybe 50 times at least a day that I thought to myself, Mandy, don't worry, it's not the cancer, it's just back pain, or it's just acid reflux, or it's just fill in the dots, it's not the cancer, take a breath. I've had so much shame that I may have put time off and actually placed myself in a position of being more at risk and disease progressing further into my body and it being too late because of his response,
Mm-hmm.
And so I was very frank with him on our follow-up of what that did to me and how I implored him to be more sensitive to the human beingness of this aspect and sensitive to, I'm in the fight for my life here every day, and I am doing my best to choose life. And I really need him to choose his words wisely, because I can't just be striking everything he says from the record. That's a major task to do
Right. And a
when you're literally
luxury.
coming to this expert.
Right. A luxury
Yeah.
for people to just brush off like, oh, just a slip of the tongue or something like that. It's really, oh, well, I'm glad that, like I said, it wasn't the case in that moment. And I think that, being on top of your symptoms and everything, it sounds like you've got a handle on that. But it is, it's just challenging because we are overthinkers because of everything that we have going on and like we're listening to, we're so aware, I feel like. And
Yes.
then to have it, explode is kind of scary. So I'm thinking of you. I hope that you're still doing well. When you were going through this, when did you decide that, okay, I'm living with this? And even though it's this cloudy in between moment of, do I have cancer? Do I not have cancer? I'm going to accept it and embrace it as this is my identity now. Because that's a really confusing point for a lot of people.
Yes. And it is a hard thing to orient towards. And I respect anyone's timeline, acceptance, or rejection of that and how it folds into their life. I think for me, as a person who is already kind of sitting at the threshold, many thresholds of life, with my clientele, with my friends and family, with my loved ones, whether it's as a birth worker or a death worker, offering therapeutic touch and space holding for so many people navigating their own healing crises, or just their own the grind of daily life and what that means in a human body. It made sense to fold and integrate my own healing process into my work. I had to reorganize my whole life and the way that I do my work and the way that I parent and the way that I friend, the way that I do everything, the way that I daughter. And most certainly, the way that I mother is very much informed by this aspect of my identity now. So I think all of those things really kind of amplified the reality that for me, it made sense to integrate it into my life as opposed to just look back on it and think like that was just a period of my life. I mean, the reality is I do have to shape my entire family and working schedule around every 3 weeks I go in for infusion. and what that means for my body and whether I can be working in the coming days and what I have to do to support my mental health through that, you know. So I was absolutely hesitant and resistant in those first several months to identify. I'm really sensitive and speak up against pinkwashing and encourage folks to really consider what it is that they're doing to expand their own awareness of breast cancer and learn about the incidence of breast cancer, really breast cancer prevention and education as opposed to awareness, because we're all fully aware. Like, I don't think we need more awareness. We need more prevention, and we need to hear more depth and nuance of stories of women, of survivors, of thrivers, of people living through cancer. And I think the kind of pinkwashing aspect, the parts of the identity that I don't relate to, like my experience did not feel like kind of pink tutu, I'm a warrior, you know, fuck cancer, doesn't even really resonate with me.
Right.
And so I think there's a real value to that. And I'm so glad that that is a piece that inspires and does resonate for part of this community. And there's also a vast amount of humans that doesn't tell the story of. And so kind of tapping into those other threads and resources and women, you know, writers that are sharing their stories of illness, podcasts like this resource is incredible to really help me on a daily basis identify as part of this community. It's a rich part of just exposing yourself to other people's stories has been helpful to me. There's a book, maybe it's in this library. Yes, there's a couple of books, Stories of Illness and Healing, Women Writing Their Bodies, as well as this book, The Wild Edge of Sorrow, that was really helpful for me coming to terms of, you know, identifying. And I also, you know, I have to, there are sometimes some days it's easier than others. Some months that are easier than others. October, I have to really, really take care of myself in October. But one of the ways that I do that is by doing what I can to advocate and share education. So I generally teach self-guided lymphatic massage in that month, in the hopes and in the knowledge that women becoming familiar with their terrain will help prevent late stage diagnoses like my own. And so building capacity to bring joy and pleasure actually into self-massage and kind of demystifying what lymphatic self-massage is and actually like demonstrating self-exam so that women can fold this into their daily practice, you know, just in whatever your routine is, when you're in the shower, when you're putting lotion on. That has actually been a way for me to embrace identifying and also, you know, share my knowledge base and come to terms with this thing that I love that is therapeutic touch. It was part of what saved my life, because it was breast massage that alerted me to the presence of cancer in my breast tissue.
I love that you're so aware of these things. And I love that you touched on too, talking about how you didn't identify with the typical groups that are usually identified with cancer, because I found myself in that same position, which is why I decided to create this podcast, because I didn't feel like that spoke to me. And I knew that I wasn't alone in that. So thank you for sharing that.
Thank you. Thank you for everything you've poured into this podcast. I'm so appreciative of your story and that reality for you, birthing this, you know, inspiring this wonderful resource of storytelling. And I really honor you for that, because I truly can only imagine the work and devotion that has to go into cultivating something like this. It's really important to find your people in that kind of same relevant timeline, and that's been instrumental for me, because the women that I'm meeting, and the men and women that, like the men that I've been exposed to through your podcast, they are so inspiring. These people are brilliant, they're badasses, and it kind of reminds me, it's a beautiful mirror reflection of just how diverse and divine this community is. And it makes it easier to identify and to be proud of, like, I'm a human having a human experience over here. And it just so happens to include disease and despair. Right. And that reality actually helps me to remain and stay positive. Like the ability to hold paradox and hold both of like, I hate this. This is awful. I would wish this on no one, to like, why not me? What am I going to do about it? And look at all these extraordinary beings that I get to identify with now.
That's beautiful. Thank you so much. I really appreciate your time. This was so perfect and informative. Like, I just think that, like you're saying, it's so rare that we find the right community in these searches online or what have you. So I'm so glad that, one, you found this great survival group. Is there a name that you go
Yeah,
with?
Young Survivors Coalition. They're a national, if not international, organization. And so I just kind of paired up with the San Diego chapter of the Young Survivors Coalition. But and I'm new to this kind of world, but from what I understand, this is, at large. So, those of your listeners that are also breast cancer survivor thrivers, this could be something to look into. I've had a great experience with them. Yeah.
Perfect.
And
well, thank you
for having me. It's been a pleasure.
And that is it, friends. Thank you so much for listening to another great episode of So Positive. Mandy, thank you so much for jumping on the call, telling us a little bit more about your experience with cancer, metastatic breast cancer, and being a freaking badass. I'm so happy that you were able to jump on the call. I really loved connecting with you and just realizing the different ways in which you can have cancer, but also the different ways in which you can look at cancer, and getting your team of helpful people around you at all times, and building your team up to be that of real sound education and real sound minds that are guiding you in this experience. I think that it's so cool, and I loved hearing more about it from you. So if you want to follow Mandy, be sure to follow her on Instagram. Links are below. Follow Still Positive for more conversations with people having chronic illness or disability. And I hope that this episode has helped you out. I know it's helped me out. So keep following, like, and subscribe. Do all of those fun things on social media, and we will be here for you. Stay sick and keep doing what you're doing, friends. You're doing great.